Hello friends, Amarji Chaudhary. I'm your learning partner, and today I have come with module 3. And as you can see, the topic is diabetes, drugs and profiling. In module 3, we are going to cover up the 4 learning objectives. One is treatment goals. Second, various antibiotic drugs, mode of action of various anti-diabetic drugs, and fourth is profiling. Now, I welcome Dr. Roshan Pawar, AGM, Medical Affairs of Subchronic Cluster, to take us and share us in details about various antibiotic drugs and profiling. Over to you, sir.
Thank you, Amarji, and namaste, friends. So, next slide. So, as we have discussed last session, that the most prevalent diabetes is type 2, and where we have seen that there is either insufficient insulin, or maybe there is a sufficient insulin, but it is not able, body is not able to utilize it properly. So, what are the goals for the type 2 diabetes control? Goals means what doctor and patient want to achieve with a proper therapy. So first is HbA1c parameter. The goal of therapy is to take it below 7, fasting or preprandial PG between 90 to 130, and peak postprandial glucose level should be less than 180. So these three are the most important goals. Next slide. So to achieve these goals, there are 3 things which are done. It is called as Triad, and it has to be together. So diet, daily exercise, and drugs. So there are 3 Ds. And in drugs, if you see, there are oral antidiabetics, and there is one different class, that is insulin. So going ahead, oral antidiabetics, there are multiple classes, but the key classes I am telling you, sulfonylureas, where the drugs like glimepiride or glipizide. Then there is a class called as biguanides, and one of the most commonly used drug, it is metformin. Then SGLT2 inhibitor, it's a recently added class. There are certain drugs, they end with gliflozin, and one of the example is dapagliflozin. Then there is a class called as DPP4 inhibitors, and these drugs are gliptins like linagliptin, sitagliptin, tenligliptin, and vildagliptin. And there is another class which is called as alpha glucosidase inhibitor. The drugs in this class are acarbose and voglibose. So briefly, we'll see the mechanism of action. Sulfonylureas, basically what they do, they increase the insulin secretion from pancreas. Drugs like metformin, biguanide class, they act on the liver and they improve insulin sensitivity. DPP4 inhibitors, they basically increase the insulin sensitivity and decrease the appetite. So they basically act on the liver as well as our GI tract. Alpha glucosidase inhibitors, they act on the intestine and decrease the glucose absorption. So these are various classes and they act by different mechanism of actions.
Dr. Roshan, for my understanding, I have one question which I like to ask you, that out of this 4 group of anti-diabetic drug, which is the best?
So we cannot see one class is better than other. So there is nothing like best in the diabetes. We have already seen the goals, and to that achieve that goals, there are different classes which are used. Sometimes monotherapy, if not control, then 2 drugs are combined. If not, then 3 drugs. The first line of therapy, that is the first drug which is normally used, is metformin, and after that, any of the class can be added or can replace the metformin. Okay. So there is no such thing that, and also we have to see the side effect profile of the drug. There are many things diabetologists need to do, like control the hypoglycemia, control the blood sugar, should be prevent the complications, and all those things are there. And considering that, the optimum combination is used. So don't confuse. There is no such thing that the best class of anti-diabetic drug.
Okay, thank you, doctor.
Yeah. So you can see the profiles, like you can see the left hand side, various profiles of the drug, like drugs causing hypoglycemia, or drugs causing weight loss or weight gain, or whether they are safe for the kidney or the GU tract, whether they are safe in the gastrite stomach, or whether they are helpful or beneficial in the patients of cardiovascular diseases. So you can see that the blue color means it is a neutral drug. It does not harm and it may not help also. The green color, it is beneficial. That means it causes benefits and not harm. Whereas you can see orange color, which is a red. That means it is a harmful. Again, yellow color is also harmful. So accordingly, the profiling is done. And accordingly, if a patient has particular problem, with this kind of profile, a doctor can select a particular drug for that patient. So this is just for your information. Next slide, Amberji. So when the diabetes, type 2 diabetes, is not controlled by oral drugs, sometimes patient needs to be shifted on an injectable drug that is called as insulin. Now, insulin cannot be given orally because it's a protein and it gets degraded into the stomach. So there are a lot of insulin preparations available and various sources, like from bovine, that means from the cows, or porcine, that means from the porks, and human. Nowadays, most of them are human. But the insulin is a very it requires motivation, it requires daily injections, and it is a little bit complicated process. However, if the diabetes is not controlled by oral drugs, the insulin is the ultimate solution. So this is it for today, friends. I will hand over it to Amarji for the concluding remarks. Thank you.
Thanks, Dr. Roshan, for taking us, in detail on the diabetic drugs and profiling. And for learners, let me actually remind you what we all learn in this module 3. Number 1, we learn about the treatment goals for glucose control. Second, we have learned about various treatment options for type 2 diabetes, focusing on oral antibiotic drugs. And third point, that is, we also learn about the mode of action of different oral antibiotic drugs, including the targeted organs. Last, not the least, the profiling of the oral antibiotic medication, we learned that. So thank you very much, Dr. Roshan, once again. And for learners, if you have any questions, please visit Alkepedia and raise your query under Ask Expert. And after watching this, now you have to attempt the quiz. Go ahead and complete it. Thank you very much.
Thank you.